A good consultation for me would be unlike my normal day, which quite often in a 10-minute consultation you can get an interruption, perhaps from one of the girls on reception asking you about another patient. So it makes that 10-minute consultation an awful lot longer. Several of those in a day makes your day an awful lot more stressful.
The consultation module can help practices in just identifying small areas which can be changed and altered to save time in the consultation. Sometimes that might only be 30 seconds or a minute, but when that's taken on a longer term view over the course of a session or a day or a week, that actually frees up quite a lot of time. For part of the consultation module, we did some peer-to-peer observation, which involved GPs sitting in with other GPs, observing movement around the room, such as looking for forms or looking for bits of equipment. And we found that often there was a significant amount of time wasted over the course of a session. So as a result of the observation, we came up with a list of kind of forms and equipment that would be standardised across all the consultation rooms in the practice, and we found that has definitely started to save us all small amounts of time, particularly for doctors who worked in more than one room in the practice.
Right, just have a seat.
When we started looking at the frustrations that we have in our working day, one of the things that came up was the fact that we are sometimes interrupted, people coming into the room for things that are just stored in the nurses' rooms. And one of the things that is stored in the downstairs nurses' room is the INR machine, which we use quite a lot. And if there are 2 or 3 nurses in, we could all be wanting that machine. So we bought a new machine. So we've now got one machine downstairs and one machine upstairs, which hopefully will reduce some of the interruptions.
We realised that we weren't using our nursing skills efficiently. Qualified nurses were doing a lot of blood tests, which should be done really by the phlebotomist. We used the nursing skills matrix to work out what procedures we did and who was qualified. Green meant that you felt like you were adequately trained at the moment. Amber meant you probably needed some updating, and red meant that you either didn't feel like you needed to do these procedures or you needed training before you went ahead. We identified some training issues and some areas that where we could take some workload from the GPs, and also where we could offload some of our workload, such as blood tests, to the phlebotomist.
We found that patients were often seeing GPs for consultations that could have been well dealt with by our nursing staff, and particularly given the high demand that we've got for GP appointments, has meant that we're now making sure we clearly identify when patients contact us exactly what they need.
Basically, we looked at every nurse's template through the practice and that highlighted for us areas that could be improved, areas that were lacking.
The data for our nurses have shown considerable variation between the different individuals. For instance, if you take tidying up time, nurses can have as much as 10% of their working day scheduled for tidying up, and others 0%, and that may be historical or it may be by design. But identifying the reasons for the variation can allow us to free up more capacity. And we won't use then expensive nursing time for doing work that they are not the best persons suited to do.
We found that over the whole of the nurses' screens for the period of a week, we were losing 31 15-minute appointments. So the aim was to reintroduce that back into the practice without actually increasing any of the nurses' working time. We decided that as it affected the nurses directly in their working day, we felt that the nurses should come up with a solution. I was a little bit apprehensive at the beginning of the meeting because I was the one that had gathered the information. I didn't want my team members to feel that it was my personal opinion, but we had an independent facilitator alongside as well, just almost as a note taker that could put ideas through, and that was a lot more reassuring. We were going to look at the nothing time. That's the biggest impact on the practice. We also felt there was a lot of time lost in having to move rooms, so we were looking at the allocation of the rooms, which is done by a separate member of the practice team. So we involved her. We've also agreed that if we did have to move, we would allocate a little time for setup and moving equipment so that we weren't then running late before we started.
It was really interesting to see the impact that Productive General Practice had on our appraisal system. We undertook the nurses' appraisals and we just noticed a huge difference, a change in behaviour
and outcomes, and nurses were looking to add improvements to their action plans.
It enabled us to work together as a team, come up with solutions that we felt we were able to manage and to keep up.
It's not something we expected, but it was just brilliant to see.
It's important that we have good consultations. I think they will improve the expectations of patients. I think they will improve the stress levels of nurses and GPs, reception staff. The whole team will come together and be able to provide a good, effective service, which is what we all want from the NHS.